When I became a student, one of the first things that happened was an open house, and it was that first intimate connection that really set the tone for the rest of the MPH program.
The content of the Queen's program focuses on the foundational sciences, epidemiology, biostatistics, critically appraising those, interpreting them, and moving forward with action. That is the focus.
One of the things that we've been very careful about when we were designing the curriculum for our program was to make sure that our curriculum was relevant. And so accordingly, we based our program on the core competencies which have been published by the Public Health Agency of Canada. Our program is a 16-month program. The students take 2 academic terms where they do coursework. Then they do a practicum working in a public health agency or something similar. And then they do a final academic term, and then they're ready to start looking for jobs in January. We've realized that there are a number of people who are working in public health agencies or in government who wish to upgrade their skills in public health. And accordingly, what we have done is we've created an accelerated 12-month program where you end up with the same MPH as the 16-month program.
The skills that I've been able to develop through the Queen's MPH program very much so are based and rooted in the core competencies of public health. And one of the skills that I felt was really strengthened during my time at Queen's was the skill of going back to the evidence and going back to the literature and critically assessing what information is out there and what information is reliable and succinct for the work that I have to do. One of the cornerstones of the Queen's MPH program is the practicum experience, and that really affords you with the opportunity to learn about a particular avenue of public health that may interest you. I did my placement at KFLNA Public Health, which is also where I'm working right now as a public health promoter. My role and responsibility was to develop a draft document of the community engagement framework that now shapes the agency. I really think that my experience was only enriched by, having a preceptor that just saw that any opportunity could be an opportunity of value.
We love Queen's MPH graduates because they are very well trained. It's an exceptional group who have a passion for public health and the skill set to be able to follow through. These students are very well educated and very well prepared for the workforce, and the knowledge base that they were provided as part of their training certainly prepared them well for a career in public health.
One of the things that pleases me the most about our program is seeing students come out of their undergraduate degree not knowing what they want to do, and by the time they leave 16 months later, they're transformed and they end up going out into places where they're going to improve Canada. And for me, that's deeply satisfying.
I was really able to find who I was. And that is something that no book can really teach you, but it's the experience that was cultivated here.